Well, fantastic, and welcome to another special edition of Case Studies with Dr. Aron Gonshor, Fluids IQ, and myself, Reed Davis, founder of Functional Diagnostic Nutrition, where our aim is to find out the underlying causes, conditions. We work with a whole constellation of healing opportunities, and then help people to recover. We help them live themselves out of whatever problems they've lived themselves into. We do that by identifying multiple healing opportunities. And today, Dr. Gonshor is going to go over some of those on a special case study. We're using the mucosal barrier assessment, which is multiple markers for multiple considerations, and I think it's just one of the most miraculous tests we have. And I'm not going to belabor it much more. Dr. Gonshor, would you like to take over?
Well, thank you very much, Reed. It's a pleasure to be able to be here again. And today, as you've said, we're going to be looking at a number of case studies. And what I'm going to do is just let everybody see it. Here we are. And so today, as you said, we're going to look at the mucosal barrier assessment. We call it the intestinal IQ. And we are going to look at a few case studies. And this is the mucosal barrier assessment. And Reed, you're quite right. It's quite a wonderful series of tests that make up this report. We're going to be looking at zonulin, at histamine, at diamine oxidase. And before we get into each one of them, I just want to set the stage by giving people an understanding of why this is such an important report and profile. When you're looking at chronic inflammatory or autoimmune diseases, the first thing you always need to think about is, okay, there may be a genetic predisposition, and quite often there is, but very often there is an environmental trigger or triggers that are doing it. Could be dietary proteins, the various peptides. It could be because of infection. It could be because of toxic chemicals, or a mixture of all of those things. And together with what is going on in this vast microbiome that populates our gut, and whether dysbiotic behavior or an unbalanced behavior of these bacteria could be causing part of the problem. And very often it is. And so the problem with the microbiome and some of these environmental triggers will set off various types of acute intestinal inflammation, meaning inflammation that is relatively short-lived and can quite often be dealt with pretty decently by the body and the way it handles things, and immune response that is done in a calculated way by the body in order to get rid of various types of antigens which may be pathologic, etc. But it goes further than that, because acute inflammation can actually lead to, in a good number of cases, to chronic inflammation. And part of that is happening because of what happens when you are looking at acute inflammation together with those environmental triggers. What it will cause is increased intestinal permeability. And when that intestinal permeability begins to change, that will very often lead to chronic inflammatory problems. And if not dealt with, that increased intestinal permeability together with acute inflammation that it causes, that is a to and fro. It becomes a back and forth issue, all of that leading to chronic inflammation. So how are we using our biomarkers? Well, the first one that we're going to be discussing in a few moments is zonulin. And zonulin is going to be looking at how intestinal permeability change, how zonulin modulates that process of intestinal permeability. And by that modulation, or sometimes reversing the process, it can very much affect chronic inflammation. Histamine and DAO. Well, what does histamine do? Well, we're going to go over that in a few moments, but really it is mostly involved with acute intestinal inflammatory issues. And it is affected, of course, by its breakdown enzyme, diamine oxidase, which we're calling DAO. And the third thing, which I'm just going to tell you about, even though we are not going to discuss it today, but it is going to be part of an upcoming advanced intestinal IQ or an advanced mucosal barrier assessment starting in a few months. We are adding lipopolysaccharide to our reports, and I'm just letting you know that that is going to happen. We're not going to be discussing it in today's case studies, but that's going to be happening in a few months. We'll update it. But lipopolysaccharide, which is due to changes in the microbiome, what does it do? It affects not only permeability, but also acute inflammation and ultimately chronic inflammation as well, a very powerful biomarker, but we'll be discussing that at a future time. Well, zonulin. We're calling it zonulin FP because zonulin is to be really considered a family of peptides because there are a group of peptides that act very much like zonulin, and we're putting it all under the rubric of zonulin. And what does it do? It is a modulator of intestinal permeability. It controls intestinal permeability. And what is effectively its physiologic role? Well, it controls the opening of the tight junctions. Those are the junctions between cells. It's a pathway, a paracellular pathway. And why is it there? Well, the body developed it in effect as a defensive mechanism. And the defensive mechanism was to deal with a way of being able to get rid of microorganisms that the body doesn't want. And what does it do? It opens up a door for the body to flush those microorganisms out of the body. That is the reason why the body developed it. It's a body's response to bacterial colonization, mostly of the small intestine, in order to get rid of stuff that you don't want in the small intestine. Just get it out of the body. And it has to be rapid. Those doors, the tight junctions, need to be able to open and close very quickly. And that needs to be able to be reproduced very, very easily. In fact, up to this day, zonulin is the only modulator of this intercellular, paracellular tight junctions, which have been described so far, that does what? That helps control macromolecule movement. If you've got large molecules that can't get through a cell, but you want to get them out of the body, the way in which you do that is you get them out between the cells. And what do? You open the door, the tight junctions, to allow them out. And by doing that, you're able to modulate immune response. It allows the body to do what's called tolerance. We're going to get things out quickly so that it doesn't become a major problem that will call for much larger armaments, much larger immune response. That's not what you want. You don't want the body to be constantly in a very strong immune response state. That's not good. So you want to be able to open and close those tight junctions and get stuff out quickly. That was a quick resume of zonulin. What's the other stuff? Well, the other stuff we're going to discuss today is histamine and diamine oxidase. Well, what is histamine? Well, histamine is one of the pro-inflammatory cytokines. There's a term. It is a particular signaling mechanism that is going to create an inflammatory response that in many cases is required to be able to begin the process of dealing with various types of pathological entities. And histamine does it in an acute fashion. In other words, it's a few minutes, several hours, no more than that. That's what it is meant to do. It is an acute intestinal inflammatory mediator. And what is histamine? Well, it is a biogenic amine. It's an ethylamine. And that's what it looks like when you look at it biochemically. And what is it involved in? Well, as I just mentioned a few moments ago, it's involved in localized immune response to try to deal with stuff very quickly, expeditiously, and get it done out of the body very quickly. So it is regulating physiological functioning in the gut. It wants to keep things on a low burn, no more than that. You don't want things to get out of hand. But histamine, by the way, also is a neurotransmitter, which we're not going to discuss today. It's for another lecture. But if histamine gets into the gut and is doing whatever it does in the gut, there needs to be a way to metabolize histamine, to get rid of it. What you don't want is to have histamine sticking around, because then there's too much of a good thing and it becomes a problem. And the way you deal with it is the way the body deals with many of these particular entities. It has an enzyme, or in this case, two enzymes that will break it down. And the one that is most important for our purposes today is diamine oxidase. And diamine oxidase is a protein which acts as an enzyme. It's in the cell membranes and little vesicles, little bubbles that you will see on the microscope in the cell membrane. And it is secreted when you stimulate the cells that produce it. It is actually synthesized by the barrier cells, the enterocytes in the barrier of the intestine. It's actually in the villi, in the villar crypts that make up the part of the cells that look into the gut. The crypts are there, and that's where diamine oxidase is produced. And what does it do? It scavenges extracellular histamine. If there's histamine-rich food that is in the gut that's been ingested, diamine oxidase gets produced, and it looks for that histamine that is in the extracellular space, glomps onto it, and actually enzymatically neutralizes it. So if you don't have enough DAO, if there's decreased DAO activity for some reason or other, it becomes an indicator of intestinal mucosal damage. I'm going to repeat that. If you have decreased DAO, in spite of the fact that there's histamine that needs DAO, but it's decreased, that means something is going on within the intestinal wall, some kind of mucosal damage that is not allowing the DAO to be produced in adequate amounts. Just for completeness, there's also histamine N-methyltransferase, HNMT, which we're not going to discuss today. You find it mostly in the bronchioles and in the prostate, etc. But it will deal also with histamine, but it deals with histamine strictly when histamine is intracellular, which is not what's important to us for today's discussion. So when you look at a report, this intestinal IQ report, the mucosal barrier assessment, we look at histamine in a dried urine sample, whereas zonulin and DAO are looked at in a blood spot. Both of these are dried indicators, one of blood and one of urine. And the reason we look for histamine in dried urine is because it is seen in much better amounts, much higher amounts, which become much more reliable to look at. And Therefore, we've decided to do it in dried urine. It still allows us to look at the effects of DAO to histamine. Even though the DAO is in dried blood spot, you can still get very good correlation of the two. So it measures histamine very accurately, reliably. It monitors conditions where histamine has a role. And I'm just going to mention this so that you remember it. Histamine intolerance, which you see here at the bottom, wants to control that. You don't want to have the problem of very high histamine. You also don't want an immune condition like mast cell activation syndrome or syndromes, where there's excessive histamine release, or systemic mastocytosis, which happens to be a rare blood disorder. So most of the time, what you're looking at is trying to control histamine, which is coming in because there's some kind of inflammation taking place in the gut, or you're eating very histamine-rich food. But what causes low histamine levels in urine or in blood? Well, it can be a diet that's very low in histamine. It's quite significant, and sometimes can cause very low amounts, 8-fold reduction in urinary histamine levels. So don't discount what diet can do to histamine. It can be very, very low. You can have renal impairment, doesn't happen very often, but if you have impairment and the renal system is not allowing proper flushing of liquids into the urine, you can get reduced urinary excretion of histamine and, of course, its metabolites. And overuse of H1 receptor blocking, of antihistamines. And we can discuss that at length, but if you have very high antihistamines, of course, you're going to have a problem with seeing histamine both in blood and in urine. So having given you that as a very quick overview, how do we read some of these assessments? Well, remember, when you're looking at the report, you're going to see these bars, which are really bars looking at quintiles. 20% of the population, 5 quintiles, 1, 2, 3, 4, and 5. And you're looking at zonulin, at histamine, and at DAO. So the range is divided into quintiles. And the result for that particular person is seen in the box. The color is related to where it lies. In this case, even though we're not seeing it, it's in the green area or optimal area. And the result in the box is also shown as a diamond sitting in the bar where it happens to be. And so you have zonulin, histamine, DAO, and then the ratio of histamine to DAO, and we'll go over all of that in just a moment. So let's very quickly look at what kind of things should we be thinking about when we see some of these results. Well, let's look at zonulin. When zonulin has its diamond in the green, why in the green? Because the zonulin here was 100 nanograms per gram of hemoglobin. Remember, we're doing that in dried blood spot. And so the analyte and its concentration has to be related to a common entity that is pretty normalized in blood. And what do we see normalized in blood? Whatever it is, whether it's blood spot or serum, that's hemoglobin. Hemoglobin doesn't change dramatically for that individual. So we're relating the concentration of the analyte, in this case zonulin, to hemoglobin. Okay, so what is optimal? Well, optimal goes anywhere from around 14 nanograms, quite low, to about 225 nanograms relative to a gram of hemoglobin. When would you see that? Well, you see that when there may be some inflammatory problems. There's always a little bit that's present. You always have some intestinal drying, meaning there's not enough mucus in the gut. There may be some deficiency of secretory IgA. We're actually going to go over that in some future case studies, actually in the next month or two, when we look at SIG-A in saliva. But if you have a deficiency of SIG-A, quite often it's because there isn't enough mucus in the gut, because SIG-A lives in mucus. And so intestinal drying can be an issue. It can be an issue, but not sufficient to cause intestinal permeability issues. That's the key. So it's still optimal. There's some inflammation, but it's still optimal. Okay, well, what if it's not optimal? What if it's borderline? And borderline can be from around 225 to about 750 nanograms. Well, what happens when it's borderline? Well, gut inflammation is getting higher for whatever the reason it is. Whatever is causing that inflammation, we're not discussing what is causing it, we're saying there's gut inflammation that is high enough to begin to affect permeability. Because remember, zonulin is a permeability issue. So right now we're talking about what can cause changes in mucosal permeability. So what can start causing sufficient inflammation to begin to affect permeability? Well, often it's due to what's going on with the gut bacteria. You can start to get an imbalance in the commensal bacteria and those pathologic bacteria, enough to cause what we call dysbiosis, an imbalance in the biotic population, and even enzyme imbalances. We're jumping ahead, but what if DAO is imbalanced? There's not enough of it. Whatever it is, that can cause borderline issues. But that's not the worst of it. The worst of it is when it gets elevated. And when it gets elevated, that is the signs and symptoms of frank joint permeability. Those particular openings in that area between the cells, those tight junctions, have opened up. They're very permeable. Why? Well, even stronger dysbiosis, even greater enzymatic problems, and hormonal problems that are beginning to affect it. And in the following case studies that we're going to do next month, we're actually going to discuss some of those hormone issues that can begin to impact gut function. So now you get excess inflammation, even now beginning to become autoimmune. And some autoimmune disorders are already established with excess inflammation. Suffice it to say, that causes elevated zonulin levels. And let me state, you would really never want to be in a condition of elevated zonulin. You do what you need to do to keep the gut from getting into an elevated zonulin level. Two other things you want to say about zonulin is, number one, it can be extremely low. It can be under 14 nanograms. Why? Well, because there's a small population, very small, that has a genetic variant. It's called the HP1-1. And that genetic variant doesn't allow that individual to actually produce zonulin. It produces zonulin-like proteins, but not zonulin. So zonulin actually becomes extremely low, almost non-detectable. And there are other people who are way above the 2,500 nanograms. These are people, and it's a very small population, thank God, because that is not pleasant. They are in an acute state of inflammation, often caused by autoimmune disease, and these people will most of the time be seen in a hospital environment because they are in acute pain as well as many other changes in body function. What about histamine? Well, histamine, its optimal level, the green, goes from very low, around 2.6 nanograms. In this case, remember, we're doing it in dried urine. So in this case, the normalizing factor is creatinine. Just like hemoglobin is very stable in blood, creatinine is very stable normally for that individual. So we look at these analytes relative to the normalizer, which in this case is creatinine. So histamine, when it's in a normal optimal level, is anywhere from very low, 2.6, to about 225 nanograms. And that's optimal. The inflammatory problems which may be around are insufficient to affect intestinal permeability, even though there is some inflammation that's being caused. If it goes below 2.6, it can happen in very, very infrequent cases. You're dealing with what's called hypohistaminuria, which is possible. We're not going to get into that. It's really quite rare. Now, what you can see also is very elevated levels of histamine, and that's greater than 330 nanograms. Now, when does that happen? Well, you can have increased gastric acid secretion and or permeability. If you have a lot of gastric acid, you're going to see a lot of histamine at the same time. If you ingest food that is rich in histamine or its precursor, what causes histamine, and that's histidine. So a lot of people who eat fish, shellfish, etc., they're taking in a lot of histidine or histamine, and they're going to suffer the consequence of that if they unfortunately get into too high a histamine level. What can also cause it? Well, a deficiency in DAO. There's not enough diamine oxidase. It's not breaking down the histamine, not sufficiently in any case. So enzymatic deficiencies like DAO or dysbiosis will cause that problem. And of course, medications and analgesics, certain ones will cause it, certain antibiotics will cause it, and you'll get it with H2 inhibitors, proton pump inhibitors, that it looks like a good 50% of the North American population is on PPIs. And why does that cause these high levels of histamine? Well, because PPIs cause it, because what do PPIs do? They decrease stomach acid. They're given because people say, I have a high stomach acid. So, okay, we're going to give you a proton pump inhibitor. Well, sure, it's going to decrease acid, but if you suppress acid, that will cause an increase in something called gastrin. And when gastrin, that hormone, increases, what does it do? It stimulates large amounts of histamine. All of that is to say, beware if you're on proton pump inhibitors, or the people that are coming for you to look at them. If they're on proton pump inhibitors, PPIs, you need to know why and to see whether or not you can do something about it. DAO at levels that are considered as borderline, that will happen because of elevated histamine, which begins to increase levels of DAO. And you'll also see it in some of the acute stages of the elevation in intestinal permeability. If you're getting increases in intestinal permeability, what it does in the beginning, you're going to see a lot of DAO produced because it's trying to deal with that. But very soon, things get out of hand, and you're going to get very low levels, and you're going to say, whoa, wait a minute. Why are we off to the right and that's low? Because unlike histamine, DAO is just the reverse. The fifth quintile is not high, it's very low DAO. And you will get very low levels of DAO with certain people who have irritable bowel disorders, certain inflammatory diseases. Many people who have autoimmune diseases like multiple sclerosis or rheumatoid arthritis are going to have very low levels. Or if you have extremely high problems with bowel disease, inflammatory bowel problems, it's going to destroy the ability of the cells of the bowel to produce DAO. And so you're going to get what's called late stages of DAO problems, meaning very low DAO. And that's going to be caused with non-steroidal drugs, antibiotics will cause it as well. Now, I told you that these reports also have the ratio of histamine to DAO. So you can have histamine, which is optimal, and it is divided by DAO, which is borderline. It'll give you an optimal ratio. Why is the ratio optimal? Because histamine levels are still relatively low. They haven't jumped to the right. So it's still optimal. And a lot of people like to just use the ratio because it's a quick way of seeing what's going on. What if the ratio is borderline? Why would it be borderline? Well, histamine levels are now elevated. They can be quite high, but it can still be controlled by an adequate level of DAO. What is happening? Remember, DAO is low to the right, and here it's getting bigger and bigger. So even though histamine is going up, the cells are producing a fair bit of DAO in order to combat this high histamine and to break it down. Because remember, DAO is an enzyme that's breaking down histamine. So it's still able to do it. But eventually, things get out of line. And if you continue to have very high, elevated levels of histamine, eventually the gut and the cells producing DAO say, I can't do it anymore. I just can't continue. And they dramatically drop to very low levels. And when they're at very low levels, you see that the ratio is extremely high. Histamine is very high. DAO is very deficient. And that's when you get into classic histamine intolerance with all of the issues that histamine intolerance brings. So let's look very quickly at 3 case studies. Number 1, elevated zonulin in the face of optimal histamine and DAO. Here's Mary. She's 57 years old. And what is she complaining of, and what are some of her symptoms? Well, she's got chronic bloating and gas. It's her most prominent symptom, chronic bloating and gas. She's got indigestion. She has that feeling of fullness. In other words, early satiety. She feels full very quickly. And postprandial, meaning after eating, she very quickly feels full. She's got this abdominal pain. It's non-specific, but it's there. Her bowel habits are very alternating. She can have diarrhea and then go to constipation. And what she has is what's often known as IBS-like symptoms. Her food sensitivities are all over the board. She gets delayed reactions to many foods, but the reactions come. And it comes to many foods. And the other thing is, she's got brain fog, mood fluctuations. She complains of anxiety, and she doesn't know why. Well, when she gets examined, she has a distended abdomen. There's visible abdominal bloating with mild to moderate non-localized tenderness. It's just a tender abdomen. The skin is dry. It has eczema-like abdominal rash. You see the rash both in the anterior and sometimes even in the posterior area. But it's not the typical red urticaria, or these raised areas of skin that you classically see with high histamine. That's the classic histaminic reaction, which is red levels of skin reaction, that rash that you see. She doesn't have that, but she's got dry skin. So what do we see? Well, we see elevated levels of zonulin, but her histamine is optimal, so is her DAO, and of course, the ratio. So what is the clinical significance that you're going to see on this test profile? Well, the first thing it tells you is that not all leaky guts, as they used to say, or intestinal permeability, are histamine intolerant. Most people say, well, it's got to be histamine intolerant. That's why they have intestinal permeability. No, you can have elevated zonulin while at the same time the DAO is normal, histamine's being broken down correctly, but the gut lining seems to be damaged in some way, and that's causing intestinal permeability. There is some kind of active gut damage because the tight junctions are actively being opened. They're being triggered by something. And what's that something? Well, most often it's gluten, which for celiacs, especially those who haven't been diagnosed, is going to cause that, or bacterial overgrowth that is not being monitored properly. Well, there's going to be some further testing, metabolic wellness profile, that's our dried urine profile, food sensitivities, SIBO, you want to look at that as well. The second case, you have elevated zonulin, again optimal histamine, but this time not optimal DAO. The DAO is low. So here's John. He's 45 years old. He's got chronic bloating. He's got abdominal distension, very much like we heard in the first case. But he really starts to develop classic IBS patterns, which is alternating diarrhea and constipation. He has a lot of flatulence and indigestion. He really gets a lot of abdominal pain and cramps. Food sensitivities, intolerances. He's developing reactions to foods that he's always tolerated, and he can't seem to understand why. The brain fog and the cognitive difficulties are becoming very intense. He has fatigue and what's used to be called tired but wired. I'm tired, but at the same time, I'm wired. He gets headaches, occasional migraine. Now he's getting a lot of skin issues that are becoming an issue for him. So the examination, he's bloated, also has significant postprandial abdominal distension very quickly after he eats. He's got chronic skin rashes and eczema and redness that's beginning to develop. He even has an allergic appearance, these dark circles under the eyes with chronic congestion, runny nose, at the same time that he feels bloated. And he even talks about high sensitivity to multiple foods. Well, again, the zonulin is high. The histamine is optimal, but in the face of very low DAO. So it's developing the possibility of some kind of histamine intolerance that's going to possibly happen pretty soon. You've got to be ready for that. So what are we looking at here? Elevated zonulin indicates that the tight junctions of the lining are open. It's allowing large molecules to enter the bloodstream, together with simultaneous low DAO, very low. The intestinal barrier has been physically damaged. It's atrophied, could be inflamed, but whatever it is, it's not allowing DAO to be produced by the cells. So it's reducing the capacity of the gut to break down histamine from food. And what is the cause of low DAO? As I said, inflamed intestinal mucosa, sometimes SIBO, or even celiac disease, which will do it. All of those also cause elevated zonulin. So what do you do? Well, the first thing you want to do is reduce the zonulin releasing agents. What are they? Gluten and bacterial overgrowth. That's what you focus in on right away. And the second thing that you're doing in this case is you've got to support that gut lining. Why? Because you want the gut to start producing DAO. And this, I would say to you, one of the things that you might want to do is consider temporary DAO supplementation. Here's the last case. This is elevated zonulin and histamine. This is the first time we're talking about elevated histamine as well. So we've got elevated zonulin and histamine in the face of very low DAO. This is not good. So elevated zonulin, we're getting to be experts here. Tight junctions are opening in the intestinal lining, often alongside multiple food sensitivities, systemic inflammation, autoimmune markers. That's what's causing the high histamine and the low DAO. So the elevated histamine, the symptoms are mimicking allergies, but when you do the standard allergy tests, they're negative. So you know it's got to be caused by something other than the standard allergy tests. And most of the time, histamine is the culprit. Low DAO, as I said, an inability to properly break down histamine in the gut. And because of that, histamine accumulates. And so you've got to look at what is damaging the intestinal mucosa. Is it celiac disease? Is it inflammatory bowel disease, IBD? Is it small intestinal bacterial overgrowth, also known as SIBO? Are they on medications that could be doing it? You got to look at all of these things, folks. Ask them, what are they taking as medications? Oh, I'm not taking what? Are you sure? Yeah, well, I've got this proton pump inhibitor. They're going to give you one of the typical names. So what are the symptoms and complaints? The GI complaints, most common, chronic abdominal bloating in well over 90% of the cases. Abdominal pain, diarrhea, all the things we talked about before. Dermatologically, things are really getting out of hand. Now they have facial redness. The urticaria, the hives, can be all over their body. They've got constant pruritus, itching. There's no rash, but they're itching. They can have dermatitis. They have swelling of the eyelids. Folks, they're in trouble. You got to deal with this. Neurologically, vascularly, they got headaches, migraines. They got these high histamine type headaches, dizziness, etc. Respiratory, because of high histamine, they've got chronic runny nose. They got the rhinorrhea. They've got nasal congestion. Remember, histamine is not just in the gut. It's all over the place. It's not just H2 receptors. They're H1 receptors that are going crazy. There's nasal congestion. They're sneezing. Sometimes they're wheezing, etc. So you're examining them. The reaction pattern, 30 to 90 minutes after eating high histamine fermented foods, there's going to be a reaction. It's chronic, goes on all day. The common causes, what are they? Elevated zonulin, triggered by what? Mostly by gluten and by a dysbiosis. Bacteria are dysbiotic. Low DAO and high histamine are both together. And the triple combination, bloating, headaches, and skin flushing after meals. If you've got that triad, you know that this is the problem. And this is what it looks like. Elevated zonulin, elevated histamine, very low DAO in the face of elevated histamine. What does that cause? A histamine DAO ratio that is almost off the charts. This needs to be dealt with expeditiously, tout suite. So, elevated zonulin, histamine, and low DAO, these are strong indicators of intestinal hyperpermeability with histamine intolerance. And there are many things that can cause it. It's seen with SIBO when it's very strong. It is seen with celiacs, which, by the way, only represents 2 or 3% of the population. Many people think they may have celiac. What they have is non-celiac gluten sensitivity. NCGS can be very suggestive of celiac. It isn't, but it's still causing them many problems. Inflammatory bowel disease, especially the two main ones, Crohn's or colitis, irritable bowel syndrome, and of course, mast cell activation syndrome, which, as you may know, is an immune response of the mast cells. And the management, of course, repair the intestinal barrier and lower their histamine load. Find out, where's that histamine coming from? Is it coming from food, or is it the mast cells that are pushing out the histamine? One way or another, you've got to get rid of it. Dietary. Get them on some supplements to get higher amounts of DAO. Start looking at gut repair. Vitamin C, B6, copper, quercetin, of course, for gut repair, etc. So I'm going to say that we're going to stop here, other than just telling you that this was the mucosal barrier assessment. Remember that what we're going to be discussing the next time around is one of our main reports, main profiles, which is looking in saliva at adrenal function, cortisol, DHEA. We're going to be looking at the sex hormones. We're going to be looking at melatonin, SIG-A, as well as insulin. All, folks, in saliva. And what did we look at the last time around? The metabolic wellness profile. And you should look at some of the previous test reports to look at what that offers you. And why am I mentioning it? Because you've got to look at this, because this will give you more information on what may be going on. And with that, a very quick thank you.
Well, thank you so much, Dr. Gonshor, for all those insights. You know, I love these three labs with all of their various markers and all of the healing opportunities that they can provide. And what it does for an FDN practitioner who's interested not in medical diagnosis, but in finding out what's really wrong with people. So many healing opportunities are identified that can be connected together. And as we do an overall view of all three of those labs and all the markers, we see stress breaking the body down and things falling apart from there, you know, and the dominoes fall in a pretty consistent manner so that you can see exactly where people are in their, let's say, journey towards worse health. And then it's much easier for you to make some recommendations to them of what to do. Again, as I said in the very beginning of this call, how do we teach them to live themselves out of the problems they've lived themselves into? You have to know what's really wrong. And so that's the key. For more information, we have fdntraining.com or wherever the team is pointing you to. And much, much appreciated. Looking forward to that next test, which actually I always considered the stress and hormone panel kind of a flagship test. And for these to be the partners in crime, you know, you almost just need to do all three. But we can't teach them all at once. So hope you guys are enjoying the breakdown, and we'll see you next time. Thank you again, Dr. Gonshor.
My pleasure. Thanks, Reed. See you soon.